I have people that come to me that say, at my 36-week appointment, my OB told me that my baby was breech and had been breech this whole time, and that we just need to schedule a C-section, and that they don't even offer, and they didn't give them a heads up. They didn't even offer an ECV. They don't give them a heads up, just try to start doing all the things. I agree. Chiropractic is a huge component as well. Body work matters.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. Welcome back to the podcast, you guys. This week's reviewer of the week is Steph Bately, and she says, truly essential. I love this podcast. I have worked in labor and delivery as a registered nurse for over 6 years, and yet I have still learned so much from this podcast. I love how all sides of every situation are approached, and it is empowering women to be in control of their birth. At 19 weeks pregnant myself, I feel so much more confident in my body and its ability to grow and birth my baby. Listening has replaced my birth anxiety with confidence and joy. Well, thank you, Steph. Nice name, by the way. I'm really happy that you're here. I love that you are listening along. And it is crazy to me how many labor and delivery nurses we have following along. And I love the conversations that we have going back and forth. And I actually think everybody listening is going to enjoy this today. But I think it will be especially interesting to those who have not maybe had experience in an out-of-hospital setting, particularly with what we're talking about today, which is breech birth. So I think today's topic might have everybody feeling a little bit upside down with birth, but I think it's an important one, probably one that we don't give enough time and attention to. And while it's true that we don't get to pick the position of our babies during birth and going into labor, we do have a lot of say on how we can approach the position that they're in. I just want to tell you guys now that a breech birth does not always mean a cesarean birth. And today I have a special guest with me that's going to talk about what it looks like to be able to give breech babies birth vaginally outside of a hospital setting. So with that, Bonnie Baker is back with me now. Hi, Bonnie. Welcome back to the show. Thank you for being here.
Yes. Hi, how are you?
Good. Bonnie is a really good friend of mine, and we have seen each other within the birth world for many, many years. Kind of as we were starting out, we connected, and it's been fun to watch her grow her business and how she works with women and clients and all of that stuff. And we've kind of got to see each other grow into our different spaces here in the birth space, and it's been really nice. So I thought we'd start with an icebreaker just for fun. I kind of stalk your Facebook occasionally, right? Like when you guys are doing your cake parties.
Yeah.
So I'm like, let's start there. Talk about your awesome cakes that you and your midwifery friends get together and just blow up the internet with. It's so fun.
Well, unofficially, we call it Cake Club. We've sort of jokingly named our cake club Ugly But Delicious because they don't always look great, but they always taste great. And we just pick a different component of a cake that we wanted to try. And we each take one of those components and we make it, and then we all bring it together and we have lunch and we assemble it, and then we slice it up and take it home to our families and try that cake. And then that way we get to eat cake, but not eat a whole cake.
I didn't realize that's what you did, that you each like, I'll take this part of the cake and I'll take that part of the cake, and then you smush it together. That's awesome.
Yeah. So somebody will make the sponge, and then somebody will do the filling, and then somebody else will do the frosting or the buttercream. And then we just kind of, once we get together, then we assemble it. And we practice our baking skills, our techniques. Yeah. It all started from making birthday cakes for our friends. And then,
that's awesome.
Yeah. Yeah. So it
No,
is
and
fun.
they've gotten super creative over the years. And I don't know which one. I think it was whatever one Whitney had posted at one point, but it was this like chocolatey, like just mess of a cake that I'm like, I want that so bad. It looks so good.
Yeah. Well, so most all of the cakes are cakes that Courtney Rich, Cake by Courtney. Have you ever looked at her
Oh, no, I haven't.
Instagram? Yeah, they're mostly her recipes. So we're not making them up. We
Oh,
did do
awesome.
one recently where I just we rotate who gets to pick. And when it was my turn, I just said, "Okay, like we each have to pick a component." And I think it stressed everybody out, but I was having so much fun because we didn't say what flavors we were going to do, and then it actually turned out to be so delicious.
Oh, that's so fun.
So,
I love it.
yeah,
I just love having little side things like that that get you through
yeah,
the day. That's awesome. Okay, so for people who haven't heard from you before or anything, will you take a moment and just chat about who you are and what you do?
yeah. It's been a minute since I've been on the podcast. I
You were pregnant.
I was going to say I think I might have been pregnant. Um, and now he's like 3.5. So, okay, well, my name is Bonnie Baker, and I am a certified professional midwife in Davis County, Utah, and I own Davis County Midwives, where there are three of us that work at the birth center, and we do birth center and home birth. My two partners, Karina and Candace. So they're both licensed midwives. And in the state of Utah, every state has different regulations. And in the state of Utah, you can choose to license or not. And so I'm certified. So I've taken all my boards, my tests, but I opted to not license so that I could attend vaginal breech births and twin births, but I mostly focus on vaginal breech babies.
Yeah, which is really what I wanted to dive into today. I think it's such a neat turn. I don't know if it's a turn or like just the direction that your birth, like who you end up being with and who you end up serving has kind of like turned into. Just watching that progression has been really neat. So, how did you get started with breech birth?
Well, I mean, if we're really going back to the beginning, it all started with you, my friend. We attended a vaginal breech birth together,
Yeah.
and I thought it was kind of a long one, and I thought we moved into that hospital and we're never going to leave. But then that mom had her baby vaginally, and she's somebody that I keep in my heart. I think about her all the time. And, through teaching classes, counseling my clients, her positivity and her optimism is something that stands out, regardless of which way, like head up or head down. Like, that was like such a learning experience for me as a doula and now as a midwife. And I loved it. And I was like, hey, great, perfect. Like, babies can totally be born breech, but it wasn't really in my wheelhouse when I started down the midwifery path. That wasn't my plan. And then Breach Without Borders. Have you looked into them, or have you interviewed Rixa at all? You should
I
interview
have.
Rixa.
She's excellent.
She's
Yes.
wonderful. Yeah. So they came to Utah to do a training, and it was on my birthday. And I just thought, well, like, nah, that's going to be my birthday present to myself. I'm just going to take this training, and I was planning at the time on licensing, and I had a birth, of course, in true birth worker fashion, right? I had a birth that night before. It was my very first ever birthday twin that I got. So I had that little birthday twin buddy, and then got a couple hours of sleep, and then showed up accidentally late to this training. And it was just so amazing. There's so much information that they share with you, and I loved it. And I just thought, this was such a good experience. Everybody needs to be breech trained because sometimes they surprise you and come out breech. And then the very next week, I was at a surprise breech.
Hmm.
And I wasn't the main midwife, but it was something that I got to assist. And so I watched it in real time. I watched it work. And that was amazing too. And then that same month, I attended two more. I was called in from other midwives that either weren't trained or were licensed and were not able to. And I that same month, I did two more breech babies, and I just thought maybe this is the universe telling me that this is something I should you know, look into more. And then, yeah, I've just had some breech babies like sprinkled throughout ever since. Every couple months, we'll do a head up baby.
That's so neat. So for the first one that you were there for and you weren't the main doula, had she taken a training? And so she must have been unlicensed herself, or was she, what
Mhm.
happens when you are licensed and you have a surprise breech and the birth is happening?
Yeah, so that midwife at the time, that one was licensed, and I think we made it to about 8 centimeters, and the midwife checked her, and she was like, "Is it okay if we get the ultrasound out?" And confirmed that her baby was breech. And she said, "I can't do this here. You have the option to go to the hospital." And the client said, "I don't want to go to the hospital." She said, "Okay, let me call around and see if there's some midwives that will come in." And a really wonderful midwife in Utah came up and did the birth. She had to drive from about an hour away, I think, from down south, and came up and did it. And in the meantime, we just continued to labor, and things, I think everything kind of, that was a big surprise. So everything kind of stopped. And then once we got the go ahead that there was a midwife coming, everything started again. The mom's body was like, "Wait, am I safe? Yes, I am." And then it just continued. And that was an awesome experience.
Wow, that's really neat. And then these other births that you attended, the ones that were sprinkled, were you the main midwife after that for these other ones?
Well, originally, like, yes and no. So sometimes I have midwives that will call me, and I am that midwife, right? That they'll call me and say, "Hey, I have a surprise breech. Can you come and take over for me?" Or they will give me a heads up prenatally, "This client, there's, breech." Some of those babies, some of those clients choose to just transfer completely into my care, and I take over care, and I'm the midwife for the rest of their pregnancy, birth, and postpartum. And then others will remain with the midwife, and then they call me and I call it a swoop in. I'll come and do the birth, and then they will resume postpartum care. So it kind of ends up being a collaborative effort, which I really love, because then I get to have these really wonderful relationships with the other midwives in my community who are so great, and I have a lot of love and respect for them.
That's so neat. So, what are I guess I'd be curious to know, can you talk about the safety of breech outside of a hospital setting? I mean, I've seen it done in the hospital. We've both seen that.
Hmm.
There were things that I liked about it. There were things that I did not like about it at all. Just for how a mom is treated, or, I mean, in that case, very bright lights. It was a teaching hospital, lots of people in the room that, because it was a breech vaginal, it's like everybody in, but because there's so many people in the room, you can't bring both doulas, and we have
Hmm.
to have all these bright lights, and people are having conversations, and you're like, this is somebody's birth. So that's really neat that there is a breech happening, but this is somebody's sacred space. So there are things that I'm
Hmm.
like, oh, I'm so glad all those people got to see it. I'm glad that, there was education and stuff happening. That's really cool. And also, she was the perfect person for it. The way she handled
Hmm.
it, like who she was, like all of that. But at the same time, I'm like, that could be a little, I don't know. If that were me, I might not have handled it so well. So I'd love to hear about kind of what it looks like outside of a hospital, and what are some of the concerns for moms that are listening and they're like, I have a breech. Is it even safe? What does it look like?
Yeah, those are really great points. Birth is not a spectator sport, regardless of which way that baby's coming out. And I think that having a breech baby doesn't really change anything that we need to do in labor and birth. There are a few differences, but really, like, we allow that mom to labor the same. We allow her to be in positions that are comfortable for her. There are some midwives who will do breech in the water. For me, the way that I was trained, it's fine to let them labor in water, but once it's time for the birth, I have them get out and birth on their hands and knees. So, like, the pushing through the actual pushing process. Because if we do have to do any type of maneuvers, it's a little bit more accessible. And the way that we read the baby, or the way that we know that baby's doing well, is by their tone of their body. And sometimes the water can make it a little bit difficult to see how that baby's doing. And if baby's doing well, we don't need to do anything. We just let that baby come out. If baby needs a little bit of support, then reading that baby's tone and that kind of helps us to know when to step in. In terms of labor and birth, right? So nothing really changes. Maybe the location, maybe land birth versus water birth. We want our moms, though, who are considering breech birth, we want to make sure that they're healthy. We want to make sure that baby's healthy, a healthy size. Things that could impact baby's size. Intrauterine growth restriction or preterm, like really, really small babies, those babies might not be the best candidate for a vaginal breech birth. We have things like gestational diabetes that can really cause some bigger babies, wider shoulders, broader chests. Um, so diabetes is something that, you know, that might not be a safe option for a vaginal breech birth. And the overall health and wellness of mom matters. If mom has a lot of other risk factors that might not make her a good candidate for an out of hospital birth, it would still apply that she might not be a good candidate for an out of hospital vaginal breech birth. So those are some kind of guidelines that I try to follow when I'm chatting with my moms. We want to make sure that they have normal head anatomy, that there's an ultrasound that shows that that baby has, like I said, normal head anatomy, typical growth, average weight size, that type of stuff.
Yeah. Have you had any scares or major concerns with any of the breech births that you've attended? So I don't want to scare anyone listening, but I know like the horror stories that women are told, right? Like, well, if you have a breech trying to do this vaginally, this could happen, especially out of hospital where baby doesn't make it all the way out or, things like that. So have you had any serious scares or concerns with your vaginal breech moms during labor?
No, all of the babies have come out, but I think that I feel really confident in the training that I've received. I've spent pretty much from the time that I attended that first Breach Without Borders training, I've spent all of my continuing education on just continuing to learn about Breach, continuing to practice my skills. And I mean, I still am not the most educated midwife in vaginal breech deliveries, right? There are midwives who have so much more experience than me, who are so incredible, who are teaching and passing down all of this knowledge, all of their skills that they're sharing. But it's something that I have practiced and have worked on. And when I have a mom coming up that I know is breech, she's someone that I'm thinking about constantly, they're on my mind. I'm reviewing all of my options and warning signs, what to look for and what to do in those situations. So, we do have some maneuvers that can help get a head out sometimes. So we like babies' chin to be tucked down to their chest. And sometimes when babies come down, they don't, and their chins are extended. And there are a few different techniques that we can do to help bring that head down. And once that head comes forward, baby's head comes out. But it's really interesting because the bitrochanteric diameter of the baby, or around the baby's hips when they're folded up in half in a frank breech position. So frank breech is when the baby is just folded in half, feet up by the face. That diameter, that measurement around baby's bottom and hips is about the same size as an average baby's head. So if we have a bum that comes down through that passage, we know that that head will also fit as well. A baby that's in a complete position or with their legs crossed, if they come down through that the birth canal in that position, that's even bigger than like a normal head circumference diameter. And we know that if they come out that way, we know we're good. We're good to go. That head will come. Most of the time, they make it a little bit easier on themselves and they slip their feet down first, which is still fine. But yeah, so we have some things that we look for to know that that baby is going to make it down. If a baby doesn't engage into the pelvis, like if the baby won't fit, if the baby doesn't engage into the pelvis head down, then like they likely or head up, then they likely wouldn't engage fully anyways, if you know what I mean.
Yeah.
Yeah.
Okay. That's I like for those who are listening, because you had said, oh, there's other people that are better trained and whatever. And I'm over here like I'm in awe of what you do and who you are. Like I have watched it. I know that like this is part of what you were supposed to be doing, like so clearly. And if I was pregnant with a breech baby, I would fly to Utah and have you be my midwife in a heartbeat, like without thought. That's and just hearing your passion and the way that you talk about it. And so for those of you that are listening, not only like if you're in Utah, go check out Bonnie for real, but you should be with somebody if you're going to have a vaginal breech birth that is educated and skilled and trained and knowledgeable. And I think the frustrating part is that the majority of hospital births now, and the reason that they're just told, well, we need to do a cesarean is because they're not trained in it anymore. This used to be something that they did in the hospital too. Everybody had this training as part of being an OB, and that went away. And because it went away, now it is not as safe to do a vaginal breech birth in a hospital. It really has to do with the skill of the providers, which is why, like you said, taking these trainings, like the fact that they exist and there's people passing it down is so important. I think you're going to be one of those people as time goes on. Like if I was still in Utah and becoming a midwife, I'd be like, please let me shadow everything that you're doing. You know what I mean? So I definitely think that's going to keep going down the line, but there are people out there that are skilled like Bonnie. And so if you're listening and your baby does end up breech, and you do want to still give birth vaginally, there are options for you. The tricky part here in Florida actually is it's completely illegal for any kind of midwife to attend a vaginal breech birth out of the hospital. And that's scary. And it leaves women, like if it were me, I would probably be one of the women, just knowing how I feel about birth and stuff, I would be willing to cross state lines. I was already willing to do that with my third, just to be able to not have to go into another cesarean trying to have a VBAC. But that's what women are looking at in order to be able to do that. And that is unfortunate. Otherwise, you end up in like an unassisted situation, which is still an option. Moms have that option to do. But if you're a mom who's like, well, I don't want to have an unassisted birth. I would like somebody skilled and who knows what they're doing at my birth space. I don't want to do this by myself, but I would like to have a vaginal breech at home. That leaves them in kind of a tricky situation. So you kind of talked about the training and all of that. It's unofficial in a sense. I don't know. And it's neat that you talked about in Utah, if you are licensed, you cannot attend. So those of you that are in states like this, you do have to look at what your state offers and what the laws are. But in Utah, you'd be looking for an unlicensed midwife. If you're in Utah, just look for Bonnie. but for real, I mean, it's crazy. I don't even know, as I'm thinking about this, I'm like, even St. George area, like if you go a little bit more south, I don't know what the options are. I don't know how many women there are even down there. So this is definitely like a skill that I hope makes its way back, but there are very few people that do it, it feels like.
I agree that it's not necessarily the setting that makes vaginal breech dangerous. It's the skill of the provider. I absolutely agree with that statement. Yes.
Yeah.
Yeah.
Can I ask just what are your favorite things being involved with this process?
What do you mean?
Like what stands out to you is like, is it the relationships that you've made? Is it feeling like you're in the right place for what you're doing? Like what's your favorite part of attending breech births?
Well, I'm a people person, so I'm an extrovert, so I love meeting new people. In that regard, the relationships that I make are like so special to me. Whether it's with the other midwives that I'm helping or whether that is with the clients. There are like Christmas cards that I get from clients that just looking at those families, looking at those smiles, those sweet babies, it just is the best thing. And that's for head up or head down babies. As for breech specifically, it's probably witnessing a mom trust her body, trust herself, recognizing the power within herself that she can do this. I think that that's really amazing. And then watching their partners in awe of what their wife is doing, what their partner is doing. That's really awesome too. I've had some partners that were like, like I just was kind of going along for the ride, but I really actually wanted her to go to the hospital. And then after the whole thing's over, they're like, that was the most amazing thing ever. She's the most incredible person I know. And that's really amazing too, to kind of watch the partners have that trust.
Yeah. No, I would think too. I mean, being in a position to give somebody the freedom to birth how they desire, I
Hmm.
think is pretty powerful. I think that's such a neat thing that you're
Hmm.
able to offer. If there is a mom who finds out her baby's breech and she would like to birth vaginally out of the hospital, what are some of the best things that you have them do to prepare to birth vaginally?
Oh, well, I always offer if they would like to have an external version, try to get baby to rotate into a head down position. If baby doesn't, they can keep trying. Like we can try it as many times as they want, but if baby's not going to turn, and we start talking about it earlier on than just the external version, but if baby's not going to turn, then I want them to educate themselves. I want them to start researching vaginal breech birth. I want them to I it's not going to work if it's just something that I want. They have to want it too. And so I have them start educating themselves. I direct them back to Breech Without Borders, and there is a parent class that they can take that kind of reviews the history of breech, the research on breech, maneuvers that I might have to do, so that they feel prepared and that they know that if we do those maneuvers, it doesn't necessarily indicate a problem. It's just sort of helping bring that baby down. And I found that people that are willing to put in that work are pretty dedicated and really want that. If they're not willing to do the research themselves, then I'm not sure that I'm the right midwife for them. If they are not wanting to be part of a collaborative team. And that's what I really believe that we should be in all aspects of birth. At home, at hospital, breech, vertex, we should all be a collaborative team. And if we're not, if there's a disconnect there, then why isn't there trust? Why isn't that trust there? And so I want them to start building. If they already, maybe they already have the trust in me, but I want them to have the trust in their bodies. I want them to have the trust of of the process. And so I think that education is power. The more knowledge that we have, the more options that we have. So that's one of the first things that I have them start doing is to research, take the class. If it's something that they want to continue with, then great. Call me and then I'll head over, but I want them to go into it with like a completely confident heart.
Yeah, I agree with you. Obviously, education is power, and having confidence in your body is so huge. I actually was going to ask you about turning a breech and what your thoughts on that were now that you attend Breech pretty regularly and stuff. I mean, I know that in my practice, I'm sure you found the same thing, that if the baby wants to be in a breech position, you can do all the things that you want, but they usually know best. There's usually a reason for that. So how do you feel about external versions in general? And kind of like, how do you prep and talk to your clients about that? And then do you ever feel like it's worth it? How often do they stick and what's involved with that? Kind of like the whole, talk to me about versions for a sec.
Yeah, I actually feel fine with them. I think that maybe doing them a little bit earlier is better. Bodhi, my baby, was actually breech for a long time. And I can't remember exactly when, maybe like 32 weeks, maybe around that time. I just woke up one day and he was still breech. And I guess maybe because of being a midwife, I knew baby's position and recognized it earlier on. And he just was like there still. And I just said, today is the day that we're going to move you. And so I actually did my own external version.
That's
on
awesome.
on myself. And he was little, and he just was like, "Okay, mom," and he moved. And I think maybe he flipped around one more time, but then he figured it out. But he had been persistently breech up until that point. And then he was born with a short cord, which was interesting. It made me wonder if that was part of it. They say that sometimes they can't turn because their cords are short. There's a lot of, I think, midwives' tales about that type of stuff. But I feel fine about external versions. If it's something that they want to try, I'm happy to help them with. I talk about them. We do them out of hospital. If we can do it during a time when we have a sonographer, then we will. If not, we have a small handheld ultrasound that we'll use just to check position of baby. We listen with the Doppler a lot, make sure the baby's doing well. Moms that try them are so strong. And in my career as both a doula and a midwife, I have seen only a handful of them be successful. And out of those babies that did end up turning in the external version, I think like only two or three actually ended up being born vaginally. For one reason or another, the external versions, there is a small body of research that says that the external versions don't actually reduce the amount of C-sections.
Interesting.
That is really interesting, isn't it?
Yeah,
So, if it doesn't work, because I have that option, that training, if it doesn't work, I'm like, oh, okay, well, we can just do a breech, do a vaginal breech, but that doesn't necessarily align with everyone else's goals, you know.
sure.
So, like I said, they have to want it as well.
You mentioned something kind of in passing here, but I agree with this completely. And you were talking about the fact that, like at yours, it was 32 weeks when you did it, and you feel like it should be done a little bit earlier. And I could not agree more. So the reason that we're told that we have to do it 35, 36, 37 weeks is because they don't want the baby to flip back. They want the baby to be big enough that there's, only enough room to tightly squeeze them to that side. But I'm like, if you wait too long, then it's much harder to get them to turn too.
Hmm.
So will you just chat about that for a sec? I love that you said that.
Yeah, I mean that's just it. Really, is that they do get a little bit harder to turn. They get comfy in the pelvis a little bit, and we do these funny things where we put our moms on an incline, we wiggle their bellies, rebozo them to get their baby up out of the pelvis, have them do inversions, and then try the external version. And sometimes, yeah, like I said, if we wait too long, they don't always work. I think it's totally valid to do all the things, all the tricks, all the spinning babies, all the inversions, all the swimming in the swimming pool, handstands in the swimming pool. I mean, ice packs, flashlights, peppermint oil, you name it. I'm like, go for it. Do it. Absolutely. Why not? But I don't know. It just does seem like if they're smaller, they're easier to maneuver, you know?
Yeah.
Yeah.
Okay. We're just going to leave that little drop right here because I know like women that are coming up against this, like ECVs are not offered before 35, 36, 37 weeks. And
Yeah.
I do think it's really important that if you are hearing this and you have a breech baby and you have a desire to use an ECV to turn that manually, that maybe look into some people that can help you a little bit earlier because I'm a big fan of that. And I too, I don't know if you remember, Dave was breech. So my third baby was breech and he was breech at like 35, 36 weeks. And I did do all the things, all the inversions and the light in the ice and the frog walks and the pool, all the things. Actually, I don't think I did the pool. I know I wanted to very badly. But I did the chiropractor as well. And that baby did turn. So these things can also encourage baby and they can be very positive and great. But you want to start them as soon as you can and earlier the better. I had tiny babies anyways, so that was probably helpful and in my favor at that time. But
Hmm.
yeah, it always drives me nuts that they're like, well, we can't do it until it's too late, you know?
Well, I
So
have people that come to me that say, at my 36-week appointment, my OB told me that my baby was breech and had been breech this whole time, and that we just need to schedule a C-section, and that they don't even offer, and they didn't give them a heads up. They didn't even offer an ECV. They don't give them a heads up. Just try to start doing all the things. I agree. Chiropractic is a huge component as well. Body work matters. Body work matters. Absolutely. Yeah. But
That it feels
it's
so
really
inappropriate
frustrating.
hearing that. Yeah, that a
It
doctor would
is.
know and not say it. Like that's your
Hmm.
body, your baby. They have information that's yours.
Hmm.
That's really upsetting.
Or I have people come to me saying, well, they thought that the baby was breech, but they couldn't confirm because they didn't have the ultrasound with them. And I feel like that circles back to, there are a number of obstetricians that are losing the skill of Leopold's or like palpating a belly and identifying. People say, like, how do you know? How can you tell? Well, having my hands on bellies multiple times, multiple days of the week, back to back to back, you can tell, you can feel when there's a bum versus a head up in mom's ribs. You can feel a baby's back. So when I hear from clients or, prospective clients saying, well, my doctor couldn't tell. They couldn't tell if my baby was breech or not because they didn't have the ultrasound. I'm really stumped by that.
Well, and even thinking back to my births where I had OBs for the two that I did, not once did they touch my belly. I had
Really?
vaginal exams and I had ultrasound, but nobody was palpating my belly. I didn't know about that at all until I took a birth course with my third. Or I took a birth course with my second. I didn't hear about it until my third. That's
Oh,
crazy to me.
yeah, that is crazy.
Yeah. So I mean, yeah, I don't know how many doctors are even
Doing it anymore.
touching the belly, you
Yeah,
know?
yeah,
Certainly for position, other than maybe, just feeling around real quick, but not, I mean, you can tell when somebody's looking for a position or not, or feeling for the head, like my midwife did with my third. And she was like, that
hmm,
is a breech baby. Feel how the head bounces back right here. And, all of
yeah,
that. So that's so interesting.
yeah.
Okay. Just before we jump off here, how can women find breech providers in their area? And, and how can they get in touch with you?
So Breech Without Borders has a registry, has a list of providers that volunteer their information. I don't know if it's a public one, but it's something that you can reach out to Breech Without Borders and find a skilled breech provider that way. And then if you're in Utah, I'm at Davis County Midwives. So you can come see me there.
I'll put all of Bonnie's contact information in the email that's going out this week and also in the show notes. So you will be able to connect with her. They also have an Instagram. I don't know if it's Karina that does that, but I love the stuff that you guys post. That's super fun.
It's all of us. It's all of
It's
us.
all
We
of you.
take
I love
turns.
it. Oh, that's awesome. But yeah, you guys post neat things and you're always talking about births and all of that stuff. But it was so neat to connect with you and hear just the way that breech has become like part of your story as a midwife. And I
Thank
just
you.
love everybody that you're serving. And I'm so glad that you were able to jump on the podcast with me today and tell everybody about what you do and make it, and just your calming voice, Bonnie. I'm just like, I feel so good about breech, in
Even
the
with my
world.
allergy voice,
Yeah, and my plugged nose from yes, yeah,
we're both
yes.
congested. It's okay. Well, thank you for having
Oh,
me on. I love it. I love that we get to just check in with each other and reconnect. And it's been 11 years, right? Because we started in
yeah,
2014 together. We were baby birth workers together.
we were with our own
You were
babies.
with our own babies. You kept me going. I really feel like there was a period of
Same.
time where I could have just like lost steam and you really just pushed me through. So
Oh, that's awesome.
I love
I
you.
love
I
you.
love this
Thanks.
podcast. I love
Yeah.
my essential birth. We recommend it to our clients.
Oh,
So
that's wonderful.
yeah.
Well, so cool. I thank you for your wisdom. Thank you for being here. I definitely want people to connect with you. And yeah, I guess have a great week.
Okay, you too. Thank you.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.